A closer look at the pumping heart. In cardiology, the study of the heart and its diseases, we often encounter conditions that affect the structure and function of these chambers, leading to various health issues. One such condition, biventricular non-compaction, is a rare but serious anomaly that can have significant implications for heart health, affecting the heart's ability to pump blood efficiently. Biventricular non-compaction, as the name suggests, involves both sides of the heart, the right ventricle and the left ventricle, leading to a spongy appearance of the heart muscle. To fully understand this condition, it's crucial to delve into the basics of heart development and the roles of these vital chambers, which are essential for maintaining proper circulation. Let's embark on a journey to uncover the complexities of biventricular non-compaction, shedding light on its causes, diagnosis, and potential impact on those affected, and exploring the latest research and treatments available. When the heart's development takes a detour, the journey of heart development begins in the womb, where a tiny, simple tube starts to evolve into a complex and powerful organ. This is a meticulously orchestrated process that transforms a simple tube into a powerful pump, capable of sustaining life. During the early stages of pregnancy, the heart's chambers, including the ventricles, undergo a remarkable transformation, forming the intricate structures necessary for efficient blood circulation. Normally, the muscular walls of the ventricles compact, becoming thick and strong to effectively pump blood throughout the body. However, in cases of non-compaction cardiomyopathy, this crucial step goes awry, leading to significant complications. Imagine a sponge with its intricate network of pores and channels, a structure that is not ideal for a heart muscle. In non-compaction cardiomyopathy, the ventricular walls resemble this sponge-like structure, with numerous deep recesses known as trabeculations, which are abnormal. These excessive trabeculations prevent the heart muscle from developing its normal compact structure, severely affecting its ability to pump blood efficiently. This developmental defect can occur in either the right ventricle, known as right ventricular non-compaction, RVNC, or the left ventricle, referred to as left ventricular non-compaction, LVNC, or in some cases, both ventricles can be affected, a condition known as biventricular non-compaction. The consequences of this malformation can range from mild to severe, depending on the extent of the non-compaction and the specific ventricle affected, impacting overall heart function and health. Right side, left side, two chambers, one vital mission. The heart is a dual pump, with the right and left ventricles playing distinct but equally crucial roles in circulating blood throughout the body. The right ventricle, often referred to as the right pump, receives deoxygenated blood from the body and pumps it to the lungs for oxygenation. Think of it as the first leg of a relay race, sending blood on its journey to replenish its oxygen supply. The left ventricle, the left pump, takes on the baton from the right ventricle, receiving oxygen-rich blood from the lungs. It then pumps this vital fluid out to the rest of the body, delivering oxygen and nutrients to every cell. This powerful chamber is responsible for the force behind our circulatory system, ensuring that our organs and tissues receive the life-sustaining resources they need. Ejection fraction, a measuring stick for heart health. Ejection fraction is a key indicator of how well your heart is pumping blood. It's like a report card for your heart's performance. Imagine a water balloon filled with a specific amount of water. When you squeeze the balloon, only a portion of the water is ejected. Ejection fraction measures the percentage of blood pumped out of the ventricle with each heartbeat. A normal ejection fraction is typically around 55% or higher, meaning that more than half of the blood in the ventricle is pumped out with each contraction. In conditions like RVNC and LVNC, the heart's ability to pump effectively is compromised, leading to a reduced ejection fraction. This means that the heart has to work harder to circulate blood, potentially leading to symptoms like fatigue, shortness of breath, and fluid retention. RVNC and LVNC, two sides of the same coin. These two conditions, though stemming from a similar origin, present unique challenges and symptoms. RVNC and LVNC, while sharing a common underlying cause, manifest differently due to the distinct roles of the right and left ventricles. The right ventricle pumps blood to the lungs, while the left ventricle pumps blood to the rest of the body. RVNC, affecting the right side of the heart, can lead to symptoms associated with impaired blood flow to the lungs. This can result in a range of respiratory issues. Patients with RVNC may experience shortness of breath, especially during exertion, as their bodies struggle to receive adequately oxygenated blood. This can significantly impact their daily activities and quality of life. LVNC, on the other hand, primarily affects the left ventricle, responsible for pumping oxygen-rich blood to the body. This can lead to systemic issues. This can result in symptoms such as fatigue, weakness, and fluid retention or edema in the legs and ankles. These symptoms can be debilitating and require careful management. In severe cases, LVNC can lead to heart failure, a serious condition where the heart cannot pump enough blood to meet the body's needs. This can be life-threatening and requires immediate medical attention. While both conditions stem from the same developmental anomaly, their impact on the body can differ significantly, underscoring the importance of accurate diagnosis and tailored treatment plans. Understanding these differences is crucial for effective management and improving patient outcomes. Unmasking the silent threat. Diagnosing RVNC and LVNC. Diagnosing RVNC and LVNC often involves a combination of clinical evaluation and sophisticated imaging techniques. Physicians may suspect these conditions based on a patient's symptoms, medical history, and physical examination. However, confirming the diagnosis requires a closer look at the heart's structure and function. Echocardiography, commonly known as an echo, is often the first-line imaging test. This non-invasive procedure uses sound waves to create detailed images of the heart, allowing doctors to visualize the ventricular walls and assess their thickness and movement. In cases of RVNC and LVNC, the echo may reveal the characteristic excessive trabeculations and impaired pumping ability. Other imaging modalities such as cardiac magnetic resonance imaging or cardiac computed tomography scans may be employed to provide a more comprehensive assessment of the heart's anatomy and function, confirming the diagnosis and guiding treatment strategies. A double-edged sword, facing both RVNC and LVNC. While RVNC and LVNC can occur in isolation, some individuals face the daunting challenge of having both conditions simultaneously biventricular non-compaction. In these cases, the heart's ability to pump blood effectively is doubly compromised, potentially leading to a more complex clinical picture and a higher risk of complications. Patients with biventricular non-compaction may experience a combination of symptoms associated with both RVNC and LVNC, such as shortness of breath, fatigue, edema, and an irregular heartbeat. Managing these cases often requires a multidisciplinary approach, involving cardiologists, electrophysiologists, and other specialists to address the unique challenges posed by this complex condition. Navigating the labyrinth, seeking expert care. Navigating the complexities of RVNC, LVNC, and biventricular non-compaction requires specialized expertise and a compassionate approach to care. If you or a loved one have been diagnosed with any of these conditions, seeking guidance from a qualified cardiologist specializing in these areas is crucial. These experts can provide personalized treatment plans tailored to your specific needs and circumstances. Treatment options for RVNC, LVNC, and biventricular non-compaction vary depending on the severity of the condition and the presence of symptoms. Medications may be prescribed to manage symptoms, improve heart function, and reduce the risk of complications. In some cases, lifestyle modifications such as dietary changes, regular exercise, and stress management techniques can play a vital role in improving heart health. The journey continues. Empowering yourself with knowledge. Living with RVNC, LVNC, or biventricular non-compaction can be challenging, but understanding these conditions is the first step toward effective management. Please like and subscribe.